natural.
I did have a doctor.
They don't like that shit.
No, not at all.
They don't get paid for
Kickbacks.
it.
There's no kickbacks. I had one doctor. He retired. He used to say, "Before I give you this antibiotic, I want you to do this and this and this." He was pretty
That's good. Yeah.
But he was an older generation doctor, right?
I'll give you a perfect example. So, 2019, something like that. So, anyways, long story short, I was at the gym and the manager was away. So I guess the gym was not cleaned properly. So, and even though like punching bags and shit, you know, you practice your clinch work and stuff like that on the bags, whatever. And I got ringworm.
Oh shit.
But I didn't know it was ringworm. So it started as a little dot right here. And I was like, first thing when I seen it was like a dot with a ring. I was like, fucking lying. I got bit by a tick. So I went to the hospital. The doctor was like, no, it's not Lyme. It's eczema.
Eczema?
Yeah.
Was it like a rash in a circle?
No, not yet. It was just a circle. So gave me some cream for eczema. Put the cream on.
Nothing.
Next thing you know, it gets bigger and bigger and starts moving. All the way up to here.
Shit, I didn't know that happens.
Right here like this. Coming up my neck everywhere.
No.
2 years the doctors here were telling me it's eczema and giving me all these different creams and stuff.
Steroids and shit.
Hold
like
on.
that.
So we went on a trip to Colombia and Gina's mother booked me an appointment with the doctor. Went to the doctor, they look at me.
Oh, I remember that.
That's ringworm.
Immediately.
But we're not going to give you any medication till we test it and figure out what type of ringworm it is.
I remember that.
They did the test, came back, gave me the medication. 1 week gone.
That was like you were wearing
2 fucking years in this country. They were giving me cream for something it wasn't.
Yeah, that was right around when we went to Wasega there, right? You were wearing your shirt. You had that big breakout on your shoulder and shit like that. Pretty damn sure, because that's right around when you went to...
I was pretty drunk for Wasega, so I don't remember.
You worked to Wasega, by
I
the
was
way.
really fucking drunk.
You see what they did with Wasega?
Well, it was either that or it was literally turning into a shit show with
It was...
those people shitting all over
I'll
the
say
beach.
them flipping foreigners.
No, it's not. It's not the foreigners.
It's
No,
not.
you can't classify everybody because there's a lot of foreigners that come to this country that are great for the country.
Yeah, I agree with that.
It was a certain group of people
People.
shitting all over the beach.
Yeah.
To go off of what you're saying, I could have died because a doctor did that when I had blood clots in my lung.
Oh, shit.
Well,
And he misdiagnosed it, gave me medication, and I'm like, now it's hard for me to, like, I'm walking and it's hard for me to walk. Like, I was like, I gotta go to the hospital. And I remember I was walking with my mom and my sister going to the hospital, and like they're walking, and I'm like, guys, like, you can slow down. Like, I can't even like walk as fast as you guys, like, you know? Go to the hospital, he's like, yeah, you have blood clots in your lungs.
wow.
I remember when I went back to the doctor and told him, like, at first I told the receptionist, her face was like, and she couldn't believe what I said. Like, I was like, yeah, I had blood clots in my lungs. The doctor basically said, like, you could have died if you didn't treat this properly.
You could have fucking died big time.
You know what I mean? They might give me medication for something completely different.
Could have triple died.
My experiences with my mom, since I was young, she used to complain about tightness in the chest. Like, she must have been 23, 24, right? And the doctors just kept saying, no, you're too young to have any plugged arteries. You're too young to have plugged arteries. She was 38 when she collapsed.
Like, there's no special cases.
Right? And then the doctors, they finally did the angiogram, and then they found plugged arteries. And the doctors told her, why didn't nobody caught this? You were born with this stuff. And they came to this country because they heard this country was supposed to be the better choice.
Because they don't...
Give a fuck.
For healthcare here, it's a swipe. Ching ching. Ching ching.
Exactly.
Yep.
Exactly.
That's it.
I didn't even know it worked
That's
like
why
that.
whenever
I would rather pay a fee
Yeah.
and get a proper diagnosis and get better than this fucking shit. So when I was like 15, I was skateboarding. I fell and I broke my forearm. I went to the doctors. The fucking guy was trying to pop my shoulder back in place.
So yeah, he was grabbing
Hold on.
your forearms too.
And this is a family doctor from my birth.
Holy shit.
And he was trying to pop my shoulder back in place and my forearm was broken.
That's fucked.
Tell me how that makes any fucking sense.
That's fucked. And I remember...
And me being young and stupid and probably high, I was like, whatever.
Whatever,
Yeah.
do what you
He
gotta
knows
do.
what he's talking about. He's a doctor, right?
Yeah. They used to give my mom Zantac 75. They said it was ulcers, it was acid reflux disease, everything but until she collapsed. After that, I never really trusted. The problem is, it's big. It's one. There's kickbacks. There has to be.
There's
kickbacks,
severe
right?
kickbacks.
Two, they're overworked. I'm not gonna say all nurses are bad. I'm not gonna say all doctors are bad.
We took Logan to the hospital because he was diagnosed with pneumonia. So we wanted to just, after a few days, just get a checkup, make sure everything was progressing good. You know what the fucking doctor said? Why would you come to the hospital? Because our taxes fucking pay for your salary. That's why we came to the fucking
And then
hospital.
you sit there in
He's
emergency.
like, you could have gone to a clinic.
Wow.
You sit there for
Excuse you?
6 hours. When I crushed
No,
my
I wanted to
finger,
grab that doctor's head.
when I crushed my finger, this finger was split clean in half, burst at the
That's the
top.
first time I seen this.
Yeah.
Oh shit, eh?
I sat in emergency. Right, drove myself there, sat in emergency. The time the doctor saw me, everything coagulated. It stopped bleeding. I was actively bleeding out. And then the doctor's like, oh, you could have just kind of squeezed it and taped it up. I'm like, bro, the hell? And then my thing is like, so when I crushed the finger, I had chipped the bone. They're worried about the bone marrow getting infected. So on this hand, they put a fanny panny on me. And then I had the antibiotics pumping in 24 hours, right? And I had taken mom to see her, I think, East York General Hospital there. Diabetic. She had to do something for diabetes. And when they do whatever they do, it knocks her out. So I was going to drive back home. The needle slipped out of my vein and it was pumping the antibiotics in between my flesh. And my skin was swelling up and it was starting to sweat. And you feel my sweat and it felt oily.
Careless.
Right?
Fuck.
So I went to Emerge. I'm like, hey, this is what's happening. My hand's actively swollen. Could you guys just readjust it or shut it off or do what you got to do? They told me I had to go through emergency. So, okay, whatever. I get it. Whatever. It's East York. People get shot every day there. Whatever. All right? Could you at least shut it off? No. All right? Sat there. When I finally got called up to the kiosk, they're like, yeah, it's like a 4-hour wait.
The thing just pumping in your hand.
And the thing's just pumping away. And then luckily, you have like the outhouse or the out triage where you go to somewhere else and they clean
The
up.
outhouse.
Yeah. And and the lady gave me her personal number. And I called her. I'm like, this is what's going on. She said, see the red button, just shut it off. You'll be fine.
Just like that.
So I know there's some nurses that are good. There's a lot of good nurses and doctors in this country. It's just that the government doesn't pay them a lot. They're
few and far
overworked.
between.
Right?
Oh,
And there's other doctors, they just know they're going to get paid
that too, the
regardless,
healthcare
right?
system is completely just like
It's fucked over here.
overrun.
But you know, you go outside of Canada, then when the number one selling point in Canada is the healthcare. At least you guys have healthcare.
You know what I don't understand either is remember that guy when the whole Lancer shit, the guy that was from here from Arizona that was in university to be a doctor. Remember the dude from Arizona? He had a white Lancer. Apparently, I don't know if it's still the same today, but you get better education for being a doctor. That's why he came up here, because he was going to be a doctor in the States, but he came up here for his education. You don't remember the dude?
No,
He's from Arizona.
That's weird. I have a nephew. He was
He looked like a skater type dude.
That was